So we talked a little bit about abdominal bracing, how to sort of brace your lower core, low back. Now the next thing I want to talk about is also there's a rib setting that occurs. So sometimes you'll see sort of like bony ribs that kind of project out like this. So we can, independent of what we're tensioning down here, we also want to set our rib cage down and in. So it almost kind of might feel like a little bit like a slouch if the shoulder blades follow, but essentially it's taking the ribs that are sort of pointed up and out, and we're going to try to set them down and tighten them in. That's going to be done by our obliques, some of our oblique muscles, and then some of our flexors as well. But we're going to try to couple these two guys together to generate a more neutral style spine while we're flexing through here quite firmly. This allows us to produce sort of like a hydraulic pressure chamber. The pelvic floor needs to be tight, the diaphragm needs to be controlled, so the breathing needs to be changed a little bit to a little bit more shallow, or just have really good control of that diaphragm when we need it, which is the preferable route. But this sort of setting, which is kind of the top of the pelvis tilting up, sort of the bottom of the sternum tilting down, tightening both the lower abdominals with the brace, and then setting that rib cage. This is a position we want to practice a lot. That sort of gives us a better appreciation for pelvic position, thoracic position when we're talking about the stomach. And these are two of the basics, abdominal bracing and that rib cage setting, that really give us that nice hydraulic effect that supports our spine all the way around like a hydraulic cylinder.